and they can also be or serve as biological specimen for viral diagnosis to diagnose the viral infection. So as the epidemiological type, we have three categories. Viral infection or disease can be sporadic, epidemic, and pandemic. I think you all know the pandemic. As we have this COVID-19 as an example, and epidemic or outbreak are regular, while sporadic are just localized in one person or other with relationship, just closed in very few people. It cannot spread in all the population. It's just restrict in few people here, closely related. Those persons with sporadic infection act as reservoir, so they have a persistent infection or latent or chronic. In such way, they keep infecting the closest members, like hepatitis B, chronically people infect the infected form. They keep as reservoir and establish the endemicity of that infection. So they will keep the virus within the area and keep infecting a few of the people close to this person. They will not cause outbreak. So outbreak or epidemic. So this is often introduced of new variant or new viruses in new location. So in that way, most people are susceptible, no immune, specific immune response, no memory. And the outbreak come from a common source, like food, preparation, new strain in immunological naive population, like new influenza virus strain, like this COVID-19. So with a new strain, then the virus can really harm the population. Epidemic concern a wide population during the same time and in a location. So it have to be limited in area. Like influenza school outbreak, so it can be in a localized area, but affect a wide population at the same time. A pandemic, we now have COVID-19, which have crossed it may concern in a short time population of global population. So that is when the pandemic comes in. So when it concerns the global population in a very short time, like COVID-19 did. We have HIV-1, which is all over. We have influenza A, the pandemic of influenza, which regularly comes in. And happen 10 years apart, regularly. And is more result of new strains. We see that in influenza that there is antigenic drift that makes a new strain from the existing strain. By combining their genome, they result in a new strain that we cause a pandemic, first epidemic, then pandemic. So as current viral infection and disease, we have congenital viral infection, and congenital may be fetal or acquired during the fetus life, or neonatal viral infection, that is during birth, and childhood viral infection and disease. Acute viral respiratory infection, that is more also often with viruses. We have gastrointestinal tract infection, with viruses. We have skin infection. We have central nervous system viruses. So this can be the category of disease that we are going to deal with in our systemic virology. Congenital viral infection, acute viral respiratory, gastrointestinal, skin, and the central nervous system viruses. So main fetal and neonate viral infection, we have Rubella viruses, cytomegaloviruses, which can be always transmit from mother to the fetus. Cytomegaloviruses also can be transmitted in uterus or during birth. Could be transferred through placenta from infected mother, and they are referred main severe congenital infections. So they cause very harm to the fetus. We have herpes simplex viruses, which mostly comes in during birth. Varicella zoster that can also cross the placenta, but also during birth. And this, which is mostly utero infection. HIV, yes, utero, but in most cases not here, but perinatal infection, and the hepatitis B viruses, which is mostly perinatal infection. And these are the most fetal and neonate viral infection that we deal with in our next lectures. In the childhood viral infection, we have measles. We see this. Measles virus, which is RNA viruses belonging to the morbiviruses, paramyxoviridae. You have rubella, RNA viruses also. Varicella, which is caused by varicella zoster viruses or human herpes viruses 3. We have mumps, which infect or is responsible for parotitis in children. As respiratory tract, we have some viruses that have such exclusive tropism for respiratory epithelial ciliated cells. They don't go far away, they only infect those cells. That is the case of influenza A, B, parainfluenza, respiratory syncytial viruses, rhinoviruses, the cause of common cold. But each group of viruses may cause different respiratory syndrome, cold, and all inflammatory of the entire respiratory system, including tracheitis, bronchitis, bronchiolitis, some flu. And clinical syndrome may characterize of a specific group of viruses. Sometimes, like cold, is typical for rhinoviruses, while laryngitis is typical for parainfluenza. Bronchiolitis is typical for CSV, syncytial respiratory viruses, and flu by influenza viruses. So some can typically produce their own typical symptoms. Some others can just be general. And also different viruses can cause the same clinical syndrome, and that is why the diagnosis comes in. So if you consider clinical diagnosis, then you will be not able to differentiate different, only limited number of viruses can be checked. As main gastrointestinal tract viruses, we see hepatitis viruses, and the cause of gastroenteritis. Hepatitis viruses include hepatitis A, B, C, D, E, with new variant like GBA. So all these are novel and have been characterized soon as a causative agent of hepatitis. All these viruses belong to different families. So like this and this are totally different, as well as this. So although they cause hepatitis, they are quite diverse. They are quite different. So this is the class that we are saying. Hepatitis A is the picorna viridae, is RNA, while B is DNA. And the HCV is the flaviviridae, RNA again, and the parental. So all these are totally different. The family are different, and the genome configuration sometimes in the way of the transmission path to the host. As gastroenteritis causative agents, Duphyterotaviruses, astroviruses, adenoviruses, norovirus, and coronaviruses. And all these are mostly harmful to children or our age. Are not detected at the same frequency. We have rotaviruses and adenoviruses, which are the most frequent in newborn gastroenteritis, and others mostly for children, but adults are rarely infected or are rarely good disease, gastroenteritis, unless they have some other underlying condition. There is new vaccine for rotavirus, for example, that limits disease to some patients or some children. And for central nervous system infection, we have acute clinical syndrome. We have chronic. So with acute, we have dysphoria, aseptic meningitis, acute anterior pulmonaritis that is caused by polio, and we have rabid viruses, which also cause acute syndrome. While chronic are often chronic and degenerative disease, which are associated with conventional agents. Any question? Hello? So as chronic and the disease are most common and associated with conventional agents. So there's no such proof that only measles cause sclerotic subacute panencephalitis. Some other viruses may cause this, but we associate this because this is the most often cause of this condition. For example, the GC viruses and papoviruses cause of progressive multiform leukoencephalitis. And all these AIDS, dementia, all these chronic conditions, degenerative conditions, are very serious problem to the host, and are caused by a diverse number of viruses, and some can be preventable, like measles. There is vaccine. Some others not easily preventable, as no vaccine, but also no way to learn about infection as earlier as possible. So we deal with specific disease in our future lecture, but for now, I think we can limit our class here. CP, are you still with us here? CP, Gapo, and Huye, turacyari kumwe aba CP cyangwa nabo bagiye? Nkuko twabivuganye rero ngiye gukora presentation assignment muzakora especially for bacteriology, where I will need you to present on different pathogen systematically. Buri group iba ifite pathogen iza presentingaho, hanyuma ngende mbakorera complementary to what you present. Then from there we also have discussion kuri buri pathogen, including the group. Nkuko twabivuze ndaza kubaha instruction muri assignment. Buri group izagira presentation ya 15 minutes n'iminota 5 ya question answer from the other people, and then we have a brief discussion quickly to each pathogen, uburyo byibuze buri muntu muri group aza participating. So for bacteriology, we will be able to cover most of the topic in that way. Ngira ngo Gako mufite groupe eshanu, l'autre 12 group, donc we will be able to cover most of the pathogen. Then I will be complementing to what you are presenting, but also share with you the note for each pathogen that were initially prepared by me. Of course, each group will submit the presentation, the assignment, sibyo, ariko banadukorera presentation ku buryo badukorera summary ya buri pathogen. Is that okay? Is that how you also do some other assignment? Nko musanzwe mukora ama assignment, murabimenyereye gukora presentation? Class CP. Is that okay? If so, Friday, Wagatanu, we continue with a lecturer of virology, but we already have the assignment. Monday, you will dedicate the time to gukora assignment. Possibly we meet on Friday for some presentation and continue on the next Monday. We do the class, we do the lecture as usual, continue with virology. Hanyuma, we already have the assignment with you. Uburyo kuwa mbere, some of my timing will be allocated kugira ngo mukore your assignment. Nono kuwa gatanu dutangire some of the presentation on the assignment. Uwundi wa gatanu. Any question so far? Kuri byose?
I think no question.
Okay, bye.
Bye-bye.
Thank you, Rector.
you.